Good morning, Chicago. Today for our health segment, we're going to go to Bailey, who is at Northern Illinois University, talking about leech therapy with one of the patients who is receiving it due to a finger injury.
You're on the air.
Thank you, Monty. Right now I'm standing outside the world-renowned NIU Wellness Center. We're going to go inside and take a look at what leech therapy is all about with Dr. Salenzi, expert in leech therapy. So if you follow me, we're going to get a glimpse of what it's like to go through leech therapy on a digital tissue plaque. Now we're inside the clinic where Dr. Salenzi is going to give us a first-hand peek at what leech therapy is all about. Follow me as we meet his patient, Mark, and understand what he's going through as he experiences his first leech therapy session. Hi Mark, how are you doing today?
I'm great, how are you?
I'm good, thanks for asking. So what exactly happened to your finger that you had to undergo leech therapy?
Well, I was surfing on vacation and I fell off my surfboard and I got bit by a baby shark.
A baby shark?
Yeah.
Ouch.
Yeah, it hurts.
Mark, what was your initial reaction when you found out you had to have leech therapy?
Well, I was a little apprehensive and to be honest, I thought it was a little bit crazy at first because I've never heard of anything like this.
I don't blame you. I know what I think about when I think about leeches, and it's not very fun.
Yes, it's very gross. But after talking with Dr. Salenzi, he assured me that this is the best therapy for me at this moment.
Well, that's good. So, Dr. Salenzi, can you tell us a little bit about leech therapy? Could I go into my own backyard and pick out some leeches to do this?
It's definitely not recommended. It has to be a medical leech applied by a certified leech therapist. So that's definitely not recommended, and your chance of infection will definitely increase if you do that.
Yikes. So, Dr. Salenzi, can you tell us how long this treatment generally takes?
Well, it depends on the leech. You know, some are picky, some aren't. But usually anywhere from about 10 minutes to an hour, and then the leech will just naturally fall off.
Oh, so when does it decide to fall off?
When it's full.
Oh. About how full can they get?
Well, again, depending on the size of the leech, it usually sucks about 5 milliliters to 15 milliliters of blood.
Wow. Good to know. Well, next can you just take us through step by step for the viewers at home so they can see what leech therapy is all about?
Absolutely. The first thing we're going to want to do is clean the area, which will decrease our chance of infection.
It's looking pretty purpley blue. Not very good color for healing.
Well, that's what, hopefully the leech will help relieve some of that venous congestion.
Ah.
Okay, so now that it's clean, I'm going to use a piece of gauze with a little hole in it and place it over the spot that I want the leech to attach. So if I can have you turn your hand right here. This will ensure that the leech doesn't migrate and will be in the exact spot that we want it. You want to make sure you're using gloves.
Looks like you got a live one.
Yeah, he's a squirmy fella.
He's ready to suck some blood.
So then you just want to kind of direct the head right over to where we want him. And it looks like this guy's attaching. Yep, there he goes.
That's creepy.
How's
There he
that
goes.
feeling, Mark?
It's weird.
Does it hurt?
I don't like it. It's not painful, but it's not normal.
A little uncomfortable for you.
Yeah.
Okay, here we are approaching an hour of this treatment. About how much longer do you think this is going to last, Mike?
Well, this guy's looking pretty full. He could pop off any minute.
Oh, there he goes. Just like that, huh?
Just like that.
Well, now that the leech is detached, Mike, what happens next? Looks like he's pretty bloody.
Yeah, actually, the main therapeutic benefits come after the leech is detached, where the wound will continue to bleed, which can continue for up to about 10 hours.
Oh, wow. So, Mark, after everything's said and done, how does it feel to have undergone leech therapy?
Actually, after having the leech come off, I feel a lot better, and it actually feels better as well.
Well, that's good to hear. What happens next with the leech? Are you going to miss him?
Actually, I kind of named him throughout my session. I named him Leroy, and I hope to see him again pretty soon.
So, Dr. Slenzi, what happens to Leroy next?
Well, he's in good hands. I'm going to bring him over here and place him in this jar that we have labeled with the patient's name because you want to make sure it never gets used on somebody else.
Makes sense.
And what I can actually do with him is I can cause him to regurgitate the blood and then reuse him for a later session.
Huh, sounds fascinating. Well, thank you so much, Mark, for letting us take a look at your therapy session with the leeches, and thanks for teaching us something about leech therapy, Dr. Slenzi. Turns out leech therapy is a viable option for venous congestion. This is Bailey Willett signing off for MMB News. Back to you, Monsi.
Well, that's wonderful, Bailey. Thank you very much. That was a very interesting video. I just want to tell our viewers that there's a lot of contraindications for leech therapy and it shouldn't be tried at home. Some of the contraindications for it include infection, allergy, blood loss, patient rejections, and revulsions. So think again before you try to go swimming in your pond and grab some leeches.